Hi, Dr. John with Pro Chiropractic, here again with Andrea, and this is part 2 of our text neck series. And in the first one we talked about what text neck is, how it changes the curvature in your spine, and today we're going to talk about the treatment we have to reverse this syndrome, to actually change the structure in your neck. So Andrea here is going to demonstrate some of the things that we have our patients do when they're on cervical curvature corrective care. And the first is the Stroop band. So the Stroop band we institute right after the patient receives their chiropractic adjustment and starts into their active rehabilitation. So she's going to take this, put it on her neck, and there's going to be 3 different motions she goes through. The first, coming down as she extends her neck back, moving to the middle, and all of these are actively mobilizing that cervical spine or neck spine to try to get her neck back into that open position. So she just did 3 of those, but during regular treatment, she would run through 25 to 30 of those to get her neck ready for the regainer chair, and that's what we'll demonstrate next. So this is a cervical regainer chair, and with the regainer chair, we have the patient positioned. We have wedges that we place behind them depending on the level that they're on, but for the purposes of demonstration today, we're just going to demonstrate with this. We have her lean straight back. The fulcrum here goes underneath her neck in a certain position. And please don't attempt this at home with your own homemade device. This is a specially made device particularly for this. The fulcrum is here where she needs it, and this can be adjusted depending on the size of the patient. And then tension and compression are applied while the muscles are relaxed to bring the head and the neck into this extended position. If you'll look, we have the external auditory meatus, or the hole in the ear, behind the shoulder, achieving a nice stretch and pull into the ligaments in there. The patient starts at about 4 minutes and works their way up to 10 to 15 minutes on this device. And she comes up out of that. Right after that, she would go back in to the Stroop band again, and then she would get her homework. And her homework is the dinner roll. And so with the dinner roll, that looks like this, she would use this device to support the change we're trying to make at home. And so simply she would lay on her carpet floor at home. If you look at the dinner roll, it has a shoulders this side, specially designed firm orthopedic wedge. Lay back. The patient then uses their hands to place the dinner roll into the same fulcrum and position that we had. They lay on this dinner roll starting with 3 minutes, twice a day, 5 days a week, and upping a minute until they get to 10 to 15 minutes, twice a day, 5 days a week, as they can tolerate. And so with this, again, we're trying to achieve a return of the curvature in the neck through a creep or a stretching of the ligaments in the spine. We combine the chiropractic adjustment, soft tissue work, together with the Stroop band, the regainer chair, and the dinner roll to get a change over time in the actual curvature or lordosis of the cervical spine. On our next video, part 3, we'll demonstrate and show before and after x-rays that shows and documents the difference that is made with this type of corrective care. If you have any questions, please post them below. Follow us online on Facebook and Instagram, and we'd love to hear your feedback. Again, Dr. John with Pro Chiropractic, part 2 of our Text Neck series.